Good afternoon, everybody. I'm Dr. Anita Gadgil, and I work as a surgeon at Bhabha Atomic Research Center Hospital in Mumbai. Today, I'm going to present my project, which is titled To Understand the Challenges Faced by Women Community Health Workers in Hailakandi district of Assam. Assam, as you know, is a hilly, beautiful region with tea gardens, but equally a difficult terrain. Breast, cervix, and oral cancers are the commonest cancers in India and in Northeast, and the incidence is rising most rapidly in the Northeast region. Most of these cancers present in advanced stages, and of course, subsequently, the mortality is disproportionately high. The Cancer Early Detection and Screening Program was launched in 2016 by Government of India, but it has met with poor compliance and partial success. Due to economic and socio-cultural barriers, people are reluctant to participate in these programs and show up for cancer screening or at the hospitals. So we at the Kachar Cancer Hospital in Southern Assam decided to promote cancer awareness and early detection in Katlichira block of Southern Assam. We recruited Ashas to conduct this awareness program and screening, and the Ashas are trained by us as ANMs, a group of people, and at Kachar Cancer Hospital, and they in turn train the Ashas. Now, these Ashas face many challenges while working in the field. And it is necessary to address their challenges and empower them to negotiate these barriers while they work. So this was the aim of my project, to inquire into various challenges that they face. These are the Ashas which are working in the field. So as a first quarter, I started developing this idea to deep dive into their challenges. And this objective itself was very challenging because I live in Mumbai. The project was in Assam. Distance was a barrier. Language was a barrier. There was no trust between me and the community. That was another big challenge. I was a complete outsider, but we decided to go ahead. Secondly, in the second quarter, I included a lot of different stakeholders like ANMs, Ashas, program managers, the Panchayat Raj members, and so on, and found ally in them and convinced them that if we look into Asha barriers, they will get benefit. Eventually, people will get benefited, projects will get benefited, and people will be able to fight cancer much better. And they were on board. So in the third quarter, we implemented this by getting all the stakeholders into action. We went to the field, conducted interviews, conducted focus group discussions, and the whole group was at the end of it geared up to look at Ashas and their challenges in a different way, in a much more empathetic way, rather than just viewing them as tools for the project. So this was a big and important change that I felt. And here I am showing the interim results of this project today. So this is a community they had. When we interviewed them, we found many different barriers, ranging from personal barriers of poor health, too many responsibilities at work and at home, to poor literacy rates, and so on and so forth. Some of the Ashas couldn't even read. They were 60, 70-year-olds, they couldn't see. So their family was also not very supportive because the remuneration that they got was very meager. Health system, the program managers, the ANMs, the Asha supervisors for whom these Ashas work, even they were not supportive because they were all the time asking for something from the Ashas, and Ashas were all the time being defensive why the work was not done, and there was hardly any dialogue, which eventually changed as we went ahead and talked to them. So these were the health system barriers. Community, of course, had their own challenges by lack of awareness, cancer as a taboo word. There was lack of trust in the community, in the health system. It was a male-dominating community, so the women were excluded, and so on and so forth. So all these challenges Asha faced and couldn't perform their duty or couldn't do their work properly and felt completely demotivated. So we got ahead and we started thinking of the next steps. So the next steps that we plan are to design interventions to mitigate health system barriers like overburdening, poor incentive money, workflow, and so on. And for other barriers, we want to train Ashas to negotiate through this community resistance and trust, build the trust. So these are the next steps, and here we are. Thank you so much. Thank you, WLH, for an amazing journey, inspiring friends, insightful touch points, and valuable mentoring. Thank you.